bundle a whole bunch of padding around the ankle and secure it with cravats. You're adding stabilization to the ankle is what you're doing. So we have blankets here. We don't have pillows or sheets. So this is what I'm showing you with. You're going to expose. The exceptions to when you would expose are if somebody has some sort of ridiculous boot on and it's actually helping to control, like it's already providing stabilization, like it in and of itself is compressing swelling and securing or stabilizing the ankle. That's kind of the exception to the rule. Things like ski boots, things like ice hockey boots, things, you get the idea? Those are the type of boots that you wouldn't necessarily remove. Some people are going to argue and fuss about that, so it may depend on your medical director, okay? Pretty much, other than that, you're going to expose. So you got to get the sock off, okay? You got to get the shoe off. He said he wants me to leave his socks on, so I will. He hates me.
Exactly.
Okay, so you expose. Sometimes you're going to have to cut the shoelaces, okay? Sometimes you may have to cut down the tongue. Make sure if you're cutting somebody's shoes up, you're communicating with them. Otherwise, try to be nice and undo it as gently as you can. Some people decide they're in so much pain, they're just like, cut my shoe off, I don't care. Like, get it off as gently as you can. And try to be gentle, and this isn't something that you're used to doing. You're used to taking your own shoes off, and you're not in pain. So it's a little tricky. You may want to have a couple hands helping stabilize, etc., etc. So basically what you're going to do is you're literally just going to lift the foot.
You still check pulse, motor, sensory, all that stuff?
Yeah. And it's going to be one of these things that depending on where you actually see the deformity and or they're complaining of the pain, you may be able to go to posterior tibialis. Likely not, because that's probably going to be swollen, etc., etc. So you're going to have to go to the dorsalis pedis pulse. And you can still do motor and sensory. You want to try to help them hold. Those are wet.
Where's your BSI?
You want to try to go to help them hold still. I'm fine. You want to try to help them hold still and ask them to wiggle gently. Okay, wiggle. And ask which toe am I touching? Okay. And the reason why you want to get the sock off is because you want to see if they're losing any color, etc. And then basically, we're just going to wrap, okay? And I'm going to take some cravats, basically folded the same way. Flip a couple now. Usually 2 to 3 cravats, depending on the size of the pillow blanket that you're using. Can I have a short form? Thanks. Let's try 3, because this is a big bang. I'm just going to lift up on the entire thing, slide these under. And again, you're just creating cushion and stability. And notice that I'm not directly on the toes. I'm kind of above the foot tying this. And ideally you want to try to create, this I tied too high. Didn't do the boot thing. A little bit better.
that be above and below the injury, or are you just kind of
So-
tying it?
There's really no, pillows are kind of better because you can kind of wrap the pillow up like that. And I could have done that with the blanket, but basically I've created stability here. He's not going to flex his foot a lot. And one of the things that I don't necessarily want to do, I'm going to teach you an ankle hitch in about a second. I don't necessarily want to take this and tie an ankle hitch and crank on this. Because what's going to happen then is that's going to apply pressure to the foot to flex, and that's the injured part. So what I'm doing is I'm literally stabilizing the foot from going sideways, right? And providing a little bit of support. Now he can still move his foot up and down, right? But he's not going to want to. So the problem is this is the end of the body, right? It's a little bit hard to create stabilization below it. I've stabilized the joint to the best of my ability by trying to provide cushioning to the foot, but I don't necessarily want to take and tie the ankle hitch here. And I haven't taught you the ankle hitch yet, but I don't necessarily want to tie the ankle hitch because if I do that, I'm going to be putting pressure on the foot to flex, and then the ankle is going to have flexion. So any questions about how to do this? You basically just take a pillow or a blanket or a bunch of sheets, and you just tie them around the ankle to give it a little stability.
You also use tape
Eh.
instead of going through all that trouble.
The problem with using tape instead of this is that this you can adjust if for some reason, see how I can get in here and check pulse motor sensory afterwards? The tape, you have to undo the whole thing and redo the whole thing. That's why cravats are kind of advantageous compared to tape.